living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
After skin cancer, prostate cancer is the leading cancer among men, and as many as 8 in 10 men will be diagnosed with prostate cancer if they live to the age of 80. So is prostate cancer basically inevitable for a lot of men as they get older, or can it be prevented? Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown, and today we're going to learn about the prostate and prostate cancer. Stay with us. Welcome back to Healthy Living for Life. Joining us this morning is Dr. Doug Kunzweiler, who is the Chief Medical Officer with Mountain Pacific Quality Health. And thanks, as always, for being with us, Dr. K.
Glad to be here. Thanks for asking.
So let's start with a basic question. What is the prostate?
Okay, so the prostate is a small gland. It's about the size of a walnut, normally. And it sits at the base of the bladder. The urethra, the tube that drains the bladder and runs out the penis, runs right through the prostate.
Okay, and so what's its job? What does the prostate do?
All right, so to explain that, we have to go back to the birds and the bees.
Okay, good.
Okay, so we know that in order to create a baby, a sperm has to enter an egg. So the sperm has to somehow get to the egg. Unfortunately, the sperm don't have any legs, so they can't walk over to the egg. But they do have tails, so they can swim. They need a medium to swim in, and so the prostate makes a medium called semen for them to swim in, and that's how the sperm gets to the egg.
Okay.
It also, that semen also has some nourishing elements for the sperm. It helps to keep them alive longer and helps make them swim better.
Okay. And the prostate changes as men get older. Everyone's does. Well, every man's does.
Yes.
So what happens? How does it change?
Well, unfortunately, as men age, it slowly enlarges. About 80% of men, by the time they're 70, have significant enlargement and probably some symptoms from that. So it's just an effect of aging.
But we don't know specifically what causes the enlargement. It just
There's some theories. We know that as you get older, your testosterone levels drop. We also know that all men have some level of estrogen in their body, just like all women have some level of testosterone in their body. So the main theory right now is that as the testosterone drops, there's more estrogen effect in older men, and that seems to encourage the growth of the prostate.
Okay. And so when that happens, what do men typically see or might notice as far as symptoms of that taking place in their body?
Yeah, so all bad symptoms. The first thing they notice is that it's harder to empty their bladder. And they don't get their bladder completely empty, and so they have to go more often. So urinary frequency, meaning every hour or so, they feel like they have to empty their bladder. And unfortunately, that can happen during the night as well. And so men are getting up 2, 3, 4 times a night to empty their bladder. Those are probably the main symptoms that people notice.
Okay. And we are focusing on prostate cancer today, but those symptoms don't necessarily mean cancer, right? So can you speak to that a little bit?
Yeah, so just the fact that the gland enlarges gives you urinary symptoms because it hinders the flow of urine from the bladder. The cancer, if it's in the right place, can do exactly the same thing, and so the symptoms can be the same. Unfortunately, the reason why cancer is dangerous is that it often doesn't present with any symptoms at all, and sometimes it has already spread by the time that people realize that they've got it.
Okay. So we're going to be focusing on preventative health. Can we start with exams? When should men start thinking about getting prostate exams?
Well, 99% of prostate cancer occurs in men who are 50 and older.
Okay.
The occasional younger man gets it, but it's mostly 50 and older. So right now, most people recommend that you start having a prostate exam for cancer at about age 50.
Okay. And what is an exam like, and what is a doctor looking for when he or she is conducting that exam?
Well, we don't have great ways to examine the prostate.
Okay.
It's in a difficult place, but the main way to look for it is a digital rectal exam. And what that means is putting the finger in the rectum. When you do that, you can press on the back side of the prostate, and that's where most of the cancers occur. The normal prostate gland feels sort of spongy, sort of rubbery. Cancer feels very hard like a marble, and so with your finger you can distinguish that, and that's the number one way to screen. And then there is a blood test called the PSA, a prostatic antigen test. And
okay, great. And I want to learn a little bit more about that, but before we go there, let's talk about how often a man should get a prostate exam. Is it a regular part of a checkup, or does it depend on their health and their history?
Yeah, it's somewhat individual. If your risk factors are not particularly high, an annual screening most people feel is adequate. If you have higher risk factors, you might want to do that more often. Or if the doctor thinks he might have felt something suspicious, he might have you come back, sooner than a year to re-examine.
Okay. And a lot of people kind of shy away from some of those exams or checkups. They're not always pleasant. So can you talk a little bit about the importance of the exam and why, if someone is nervous, they should think about it anyway?
Right. It's not pleasant. But on the other hand, if you discover the cancer early, your treatment options are increased. Your chance of getting rid of the cancer before it has a chance to spread and cause real damage are much greater. So it's not pleasant, it's sort of inconvenient, but it, on the other hand, is cheap, it's easy, it's quick, and it can do a world of good for you.
Okay. And I talked about how often to get an exam. Lots of times when we talk about these things, family history plays a role. Is that the same with prostate cancer?
There is a family connection. Your risk of prostate cancer is increased if you have a first-degree relative. So that means a father or a brother. So cousins don't raise the risk, uncles don't raise the risk, but a first-degree relative increases your risk somewhat.
Okay. All right. Well, we are up on a break, so we're going to pause here. But when we come back, we're going to talk about what does raise your risk for prostate cancer and what you should do to help lower that risk, either for you or a loved one who might be in danger of developing prostate cancer. We'll talk about that right after this. Stay with us. Welcome back. We're still talking with Dr. Doug Kunzweiler, and this morning we're learning about prostate cancer. And so, Dr. K, I have the stat that 1 in 8 men is going to be diagnosed with prostate cancer at some point in their lives, and that number is even higher in different groups of men. So let's start with, do we know what causes prostate cancer?
Well, we don't. We know that in Western industrialized nations, it has a much higher frequency than in third world countries, for instance. So there's some suspicion that it has to do with the Western diet, eating a lot of processed foods, or it may be related to exposure to industrial materials, industrial waste, that sort of thing. But those are just theories. Nobody really knows exactly why.
Okay, but we do know what the risk factors are for prostate cancer. Is that true? And
yes, the risk factors are pretty clear.
Okay.
Age is the biggest one. The older you get, the more likely it is that you will develop prostate cancer. As you said in the opening, something like 80% of men at age 80 will have it. Ethnicity is a big factor. Black men have an increased rate of prostate cancer compared to Caucasian men. Hispanic men have rates that are lower than both of those groups, and the lowest risk of all is for Asian men. So ethnicity is important. And then, as we talked about before, if you have a first-degree family relative who had prostate cancer, your risk is increased. If you're obese, your risk is increased. And then there are certain other chronic illnesses, chronic inflammation, especially like rheumatoid arthritis, things like multiple sclerosis, but also diabetes, hypertension. There are a number of chronic illnesses that raise your risk for it.
Okay, some of the usual suspects
Usual
in there.
suspects,
Yeah, okay. So what about if someone has not gotten an exam and is developing prostate cancer, will they notice any signs or symptoms that would indicate cancer?
They might. They might have obstructive symptoms just like they do from the prostate enlarging normally. So they might have trouble emptying their bladder. They might be having to empty frequently. They might be getting up at night to empty. But you can have cancer and not have any of those symptoms, which makes it more dangerous. If it spreads, then they're likely to have symptoms like weight loss, fatigue, bone pain. Prostate cancer tends to spread to the bones, and so pain in the bones is a late sign of it.
Okay. So if a man has some of those risk factors that you talked about, maybe a chronic illness or it's in their immediate family, what should they be talking to their doctor about?
Well, they should let their doctor know about those risk factors and about their concerns. And they should be asking, should I be screened? Would it be a good idea for me to see a urologist and get some more advanced screening? They should just go in and talk to their primary care person and express their concerns.
Okay. So before the break, we did talk about those exams or the common screenings that men can do. What tests that a doctor might do specifically to check for prostate cancer? So you said there were mainly two?
Yeah, the digital rectal exam, and then also the PSA, which is a blood test, the prostate specific antigen. And that's somewhat controversial. The problem with the PSA is that you can have cancer and have a low PSA, or you can have a normal prostate and have a high PSA. So it's not very sensitive at picking up cancers. If you do have cancer, it's a good way to follow it, because if your treatment is successful, the PSA will go down, the number will go down. So it's useful for that. And it's widely used as a screen, but there's a lot of, it's not the best screening test that we have. There's a lot of controversy about it.
So it's a blood test, and so what is in the blood that raises or lowers that number?
The prostate manufactures prostate-specific antigen, and it's a material that actually helps the sperm to swim in the semen fluid. It also softens up cervical mucus, and it makes it easier for the sperm to get to the egg. So that's its purpose. Normal prostate cells make it, also cancerous prostate cells make it.
Okay.
And it's detected in the blood.
Okay. So if someone is diagnosed with possible cancer or something is found and a biopsy is done, are there side effects to that?
Yeah, the biopsy is, if you have enough suspicion, then biopsy would be the next logical step. And the biopsy is done with a needle, and it can either be done going through the rectum or through the perineum, which is the space right in front of the rectum, between the rectum and the scrotum. Those sound very unpleasant, but actually they're very well tolerated. About half of men who have a biopsy have no symptoms at all, and the other half have some mild discomfort for a while. So it's a good test, and that gets some tissue to be looked at under a microscope looking for cancer cells.
Okay, so if someone wants to get screened for prostate cancer, is that something that they can request or talk about, or how does that process usually happen?
They can certainly talk to their primary care provider about it, and tell them that they're worried, and they should be screened. And if it seems like their risk is high enough, then a biopsy should be done.
Okay, and then you mentioned this a little bit earlier too. Earlier with cancer is typically better, and that's also the case with prostate cancer.
Yeah, the good news about prostate cancer is that in America, the 5-year survival, that is people who live 5 years after at least 5 years after their diagnosis, is 98%. So it sounds dismal, but a 5-year survival of 98% is pretty good.
Yeah, that's great. All right, we're up against another break, so we're going to pause here. But when we come back, can we prevent prostate cancer? We're going to look at some possible tactics. Stay with us. We'll talk about prevention right after this. Welcome back to Healthy Living for Life. Dr. Doug Kunzweiler is still with us, and now we're going to talk about whether we can prevent prostate cancer. So Let's just ruin the big surprise right off the bat. Can you prevent prostate cancer?
Not really, no. We can modify some of our risk factors, but in terms of actual prevention, not much there.
Okay, so let's see what we can do about those risk factors. And let's start with nutrition. Are there certain foods men should or should not eat that might affect their prostate?
Well, the main thing we know about that is that people who are vegan, who have an all plant diet, have very low rates of prostatic cancer. So that's one thing. If you don't feel you can be that strict with your diet, reducing the amount of red meat and reducing the amount of animal fat that you consume is helpful.
Okay. And I read recently that focusing more on vegetables, especially cooked tomatoes, broccoli, cauliflower, that was better for men than fruit. Is that right?
Yeah, I think there is something to that. It's not a real strong association, but actually citrus has found to be helpful, and tomato is essentially a citrus. And the broccoli and cauliflower have been associated with lower rates of all types of cancers, so they seem to have a little bit of protective value.
Okay. How about hydration? And what does that do for the prostate, and are there certain drinks that men should drink or maybe should avoid?
Well, I don't know that hydration with water does a whole lot specifically for the prostate. I mean, it's a good recommendation in general. But what we do know is that caffeine and alcohol are not particularly good for the prostate, and they do slightly raise your risk of prostatic cancer and just prostatic enlargement. So cutting back on the alcohol and caffeine and increasing the water is probably a good idea.
Okay. Yeah, that is pretty sound advice no matter what, huh? All right, so what about men who take super vitamins or some of those mega vitamins, or they're on supplements of some kind? Do they need to be careful?
Yeah, there's no evidence that that's helpful. It certainly doesn't help reduce the incidence of prostate cancer or any other cancer as far as that goes. The only thing I know of is that if you have a low vitamin D, your risk is a little bit higher. So having your vitamin D level checked and supplementing that if it's low is a reasonable thing to do. But otherwise, the supplements don't do you much good.
Okay. So calcium, is that something that can affect prostate health? What should men know about calcium?
Yeah, actually calcium supplementation has been found to raise the risk slightly. Now, we need calcium to build strong bones and for other processes in our body, so it's important to have a calcium that's normal, but taking supplements of calcium to raise your level higher is probably not a good idea.
Okay. All right, so we've covered the big one, nutrition, diet. That's always the number one. Number two, exercise. So let's talk about that. How does exercise promote prostate health?
Well, we don't know exactly how it does it, but we know that it does. The more you exercise, the less trouble you will have with an enlarged prostate and the lower risk you'll have for prostate cancer. So vigorous exercise, walking, jogging, bicycling, swimming, anything that gets your heart rate up, doing it for 20 minutes at least 4 or 5 times a week is helpful.
Okay. You mentioned alcohol. Let's talk about another habit that isn't the healthiest, but a lot of people still do, smoking.
Smoking, yeah, smoking is, it's the big skull and crossbones. Now, smoking has been associated with almost every form of cancer that's been described. So not only is it bad for your heart, not only is it bad for your lungs, but it also promotes cancer, and people who smoke have a higher risk of prostate cancer.
Okay. So let's kind of switch gears and talk about mental well-being. Stress, a lot of men are higher stress, under a lot of stress. Does having high stress in your life impact your prostate?
Well, yeah, we know that there is an association between higher stress and all sorts of chronic illness, including cancer. And it may be that how that works is if you're under high stress, you have a tendency to drink more coffee, to drink more alcohol, maybe to smoke, maybe to get less exercise. So trying to reduce your stress and live a healthier lifestyle reduces your risk.
Okay. Do you have some tips about how a guy might be able to manage his stress or cope a little bit better than turning to some of the
I think staying socially connected is one of the biggest things you can do. Meet with family, meet with friends, have times when you're not worrying about your job and you're not worrying about the rest of life. So that's that's good. Exercise is a good way to reduce stress, things like yoga, walking, those are good stress relievers. And if it's gotten to the point where it's interfering with your life, interfering with your sleep, then I think seeking some kind of counseling and some behavioral therapy can go a long ways towards teaching us how to deal with our stress.
Yeah, great, good advice. So you mentioned diabetes. What about like blood pressure or some other chronic conditions?
Yeah, high blood pressure has been associated with a greater risk for prostate cancer. And again, we don't really know the mechanism of a lot of these things, but any disease process that involves chronic inflammation or chronic irritation, things like arthritis and some of the other rheumatoid diseases are associated with higher risk.
Okay, so our clock has about a minute left. Dr. Kunzweiler, any final thoughts or messages you want to make sure men or people who love men hear today?
Yeah, my message is do not fear the finger. Go to your doctor, get screened, and might do you some good.
Okay, all right, so those exams really are important.
They are important.
Yeah,
Yep.
Just get it done. All right, well, thanks so much for all your time and your expertise this morning. We appreciate it. And thank you so much for tuning in and seeing us this weekend. We hope you'll come back and see us again next weekend. And until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week, everybody.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.